All right, we have about 15 seconds.
All right.
That's right, and a big thank you to Desert Financial Credit Union for sponsoring the KRIM Community Spotlight program. Good morning and happy Wednesday to everyone listening. Chris Higgins in the studio, and this morning is our Banner Payson Medical Center Day. In the studio with me is the CEO, Hoyt Scablin. Good morning, Hoyt. How are you doing?
Good morning. Doing great, and thank you for having us.
Oh, thank you so much for coming on our Community Spotlight program each month to share what you have going on with Banner Payson Medical Center. And today we have a special guest that is coming to us telephonically because he is in Los Angeles, and that is Dr. Nikhanj, and he is the Associate Director of Banner's Telehealth program. Good morning, Dr. Nikhanj.
Good morning.
How are you doing this morning?
I'm doing great. Thank you for having me.
Oh, you're so welcome. Thank you so much for coming on the program this morning. How is the weather there in LA?
It's actually surprisingly a little overcast right now, but living in Southern California, I certainly cannot complain about the weather.
No, that's one thing you do not hear Southern Californians complaining about the weather. There's maybe some other things that are going on, but definitely the weather isn't one of the areas that you have a gripe with. Well, again, thank you so much for coming on the program this morning and to talk about the telehealth or program, and specifically the Tele-ICU program. Can you just give everyone just a little background about yourself?
Sure. So, I was born in Green Bay, Wisconsin, so go Packers.
Go Packers.
Sorry to those Packer haters out there. And then I actually, I kind of been around. So I grew up in Canada, in Calgary and Alberta, and I was there all the way through my undergraduate studies. And then I actually went abroad to study medicine in Europe and Poland, and lived there for 4 years before coming back to the U.S., where I did my internal medicine residency at George Washington University in Washington, D.C. And I was there for a total of about 5 years in D.C. And then I came out to Los Angeles back in 2008 to pursue my pulmonary and critical care fellowship, and ended up doing a sleep medicine fellowship as well. And my family and I, we've stayed in Los Angeles since.
Wow. So you have a little bit of experience then in different parts of the world.
Yeah, I guess you could say that. I've had the opportunity to experience healthcare in a few different spots around the world.
Dr. Nikhanj, I'm curious, do you speak more than one language, or are you like myself and speak one language?
I do speak more than one language. Yeah, one of the great things about traveling to study abroad was, I got to learn Polish. I learned about the culture. It was a great chance to see new things, meet new people, and it was really eye-opening. And most importantly, I met the love of my life there. And we've been married now 17 years. So I've been married to a Polish woman for so yeah. So I had the chance to learn Polish, and I have an Indian background, so my parents spoke Hindi and Punjabi in the household, and then growing up in Canada, I also had the opportunity to learn French. Now, I will say that I'm a little out of practice with those languages, but yeah, I did have the opportunity to be exposed and learn those languages growing up.
Impressive, thank you.
Yeah, and now you are again the Associate Director of Banner's Telehealth program, and
Correct.
Working with the Tele-ICU program. And how long have you been working in Tele-ICU?
So I actually started working in the Tele-ICU program back in 2011. I was actually in my sleep fellowship at the time, and so I was just starting off doing a little bit of moonlighting in the program. And then when I finished my fellowship in 2012, I was offered a full-time position doing tele-ICU. And at that time, tele-ICU was still kind of, I don't want to say in its infancy, but it was still a very much a growing field. So it was an unusual career path to do it full-time, but I jumped on the opportunity, and then shortly thereafter, I was offered a leadership position, and so I've been doing it ever since then.
And Hoyt, can you, I guess, maybe explain to listeners the benefit, or what does this program that Banner has, mean to Payson residents and Rim Country residents?
Great question, and as one who is passionate about rural health, that's always been my focus. And one of the disadvantages can be geographic distance from epicenters of the highest skilled physicians relating to intensive care treatment. And through tele-ICU, we're able to bring the skills and knowledge that Dr. Nikhanj and his colleagues have to Payson every day, 24 hours a day when needed. And so I was the CEO in Banner Churchill Community Hospital in Fallon, Nevada, just after they implemented Banner's tele-ICU. So a few years after Dr. Nikhanj began, he likely visited with ICU patients in Fallon, Nevada from Los Angeles. Banner has 10 rural community hospitals across 6 states. All 6 of those states are served through Dr. Nikhanj's group. And ultimately what it does is it allows the hospitalists, so we employ a hospitalist who are experts at taking care of patients overnight in the hospital for various conditions. Could be as simple as pneumonia, but the sickest of those patients are admitted to the intensive care unit, the ICU, and they're very complex patients to treat. And Dr. Nikhanj, in his specialty training, he's an expert at monitoring those patients through their laboratory results, through consulting with our hospitalist, and also on his team are a group of critical care nurses who help us monitor these patients. So we have several second sets of eyes. In some ways, you're in better care because you have everybody circled on you, and we have fewer of these patients. We only have a license for 4 ICU beds. In the pandemic, we received permission to flex up to 7, and but so you're not on a unit of 20 or a unit of 30, and so you're really a guest in our home, and we invite Dr. Nikhanj into the home to help provide care. I hope that gets to answering your question.
And I guess, can you explain a little bit how that is accomplished, or what equipment, or exactly, how do you bring Dr. Nikhanj and his, crew, his staff, to Banner Payson?
Great question. Dr. Nikhanj, I think I'll add to anything that I think this is your area of expertise. And what's the equipment, what's the method, and then what's the process? How do you get invited into the room, and what does your team do?
Sure. I guess first I'll start off by describing the equipment. So every ICU room across the Banner healthcare system, which includes not only those 10 rural facilities, but also the additional 17 larger metropolitan facilities across the Banner system. But every ICU room is wired with a camera that we can manipulate, with a monitor, a speaker, and a microphone. So that allows us to have two-way audio-visual communication. And of course, from our remote sites, we have access to the electronic medical record. So we're really able to help evaluate and assess your most critically ill patients, and provide full cognitive support to the bedside hospital teams. So the way it functions in the rural facilities, like in Payson, is, as Hoyt had mentioned, you don't have bedside ICU physicians there. So we act as the primary ICU doctors, the consultants for those patients. And so as part of our regular workflow, in the mornings, we round on any ICU patients that you might have. So we review the charts, we camera in and view the patients. We touch base with the bedside nurses, and then we touch base with the bedside hospital medicine doctors to formulate an assessment of what's happening with the patient and formulate a plan of care. And so it really is a team effort between the bedside providers and nurses and our tele-ICU providers and nurses to bring the highest quality critical care to your sickest patients.
Dr. Nikhanj, could you add, that was an excellent description, just add some color by example, patients that require a ventilator machine to assist with breathing. Could you just describe for the audience the role that you and your team play in helping the local hospital team with ventilated patients?
Absolutely. So patients who suffer from respiratory failure from a number of different causes who need what we call mechanical ventilation or invasive mechanical ventilation, that it requires a level of expertise that falls into our realm of critical care. So most physicians who do not train in critical care don't get that level of training needed to manage those patients. So we are basically able to leverage the technology, not only the data that feeds into us through the electronic medical record, but also just by being able to view the ventilators and what's happening with the patients on the ventilators in real time. We're able to help manage those ventilators and make adjustments needed to optimize the care that the patient's receiving, the support that they're receiving.
Excellent, thank you.
So this program, the Tele-ICU program, must have been a critical or vital program during COVID. How much more busier or how much more involved were you during the pandemic?
Yeah, no, that's a great question. As you may know, there already prior to the pandemic, prior to 2020, there was a growing physician shortage nationwide, especially with critical care physicians because of the expanding and aging U.S. population. The pandemic really highlighted and exacerbated that problem, and so as the volume of patients rose exponentially, the number of physicians available did not. So we really had to think out of the box in terms of being able to manage that high volume of critically ill patients. We had to staff up and pull in extra doctors to work and to help us cover that extra volume. And even with that increased staffing, everyone was stretched. We had to rely more on our hospital medicine partners to collaborate with them to create critical care teams to take care of these larger volumes of patients. So people were being stretched outside their comfort zone, and it really was a challenge. There's no way to sugarcoat that. But as working closely with the excellent hospital medicine team at Payson, we were able to get through hopefully the height of it, and hopefully we won't have a return to that. But it really was a remarkable challenge that we faced.
Again, for those just tuning in, talking with Dr. Nikhanj, Associate Director of Banner's Telehealth Program, and he is with the Tele-ICU program. And I really, in talking about this and listening to you explain the program, it seems like it's a program that is only going to expand and get bigger, probably going into more and more hospitals across the country, I would imagine. And do you see that happening, or have you seen that happen since its inception, or since you began involvement in 2011?
Yeah, absolutely. I believe the number of wired beds, we call them, in the tele-ICU world has grown exponentially across the country. The number of new tele-ICU programs popping up has grown, and for those very reasons that I cited before. And, everyone understands that critically ill patients, our sickest patients, really need an ICU expert watching them 24/7, ideally. But there just aren't enough critical care physicians to go around to be able to do that, especially when you're talking about, the smaller rural hospitals. And so this program provides a platform by which we can try to achieve that goal. And we've managed to successfully achieve that in Banner, and as Banner continues to expand, so too does our tele-ICU program. But I know there are many other excellent tele-ICU programs across the country that are doing the same. And I can't give you the exact figures as to how many ICU beds are wired currently, but I know that number grows every year.
Wow.
And it is such a, I'm getting old, so I was managing hospitals before tele-ICU, and it's a miracle. And we often focus on what's broken in healthcare, and especially in the American healthcare system. This is something that is an example of the innovation in healthcare. This is something that Banner was a leader in, and now it's becoming the standard of care to be sought after. And one day, somehow, despite the shortages, but through creative means that Dr. Nikhanj and others will bring about, this will be the standard in all hospitals. And we're proud of Dr. Nikhanj and his team. And I don't ever want to need ICU care. I'm sure one day that will happen, but I want to be in a Banner hospital with Dr. Nikhanj and his team, supporting my caregivers that are local. And it's just a fascinating and humble thing to watch when you see our nurse looking up at the monitor talking with the doctor, and you see our doctor talking to Dr. Nikhanj, and the patients listening, and it's a powerful thing to just peek your head in and see. And we're grateful for. Thanks for all your years of training, Dr. Nikhanj. That's a lot of school. How many years total, including first grade?
Including first grade, wow, I don't think I counted that far back. I believe altogether, since graduating high school, I did about 16 years of training.
Yeah, unbelievable.
So 28 years approximately.
Of total training.
Total training.
These subspecialists, we would refer to this generically as Dr. Nikhanj, he's a multiple subspecialist when you hear his training. Unbelievable personal sacrifice and intelligence. And we're grateful for you, Dr. Nikhanj, and you can share that with your team in your next meeting. That in Payson, Arizona, we're thankful for all of you who commit yourselves to an entire life of saving lives. Grateful for that.
I really appreciate those kind words. Thank you.
It is amazing. I don't think a lot of people realize with telehealth, telemedicine, the, oh my gosh, incredible impact it has on rural communities like Payson, where you get experts like Dr. Nikhanj in different fields that you have access to.
One of the I guess unintentional or side effects that's possible that's possible through this, it helps us when we recruit hospital medicine physicians, hospital ICU nurses. Often they will come from a metropolitan setting that has higher volume, greater numbers of physicians to support them, and they're worried about entering a rural hospital. And so we tour them through the ICU and we introduce them to tele-ICU, and you can see the relief or the ensuing confidence come. And it's a retention tool for staff, and hopefully as patients experience it and those of you hear about it, it increases your confidence level in our ability to care for those at closer to home in equally high of caliber way. And we won't keep an ICU patient in Payson that we cannot provide the same level of care that one of our larger hospitals can do. But we're trying to expand our capabilities so we can care for more people closer to home. It's nice for people to be able to come visit their family member, just get off work and drive to Banner Payson Medical Center, versus drive to Phoenix and drive 90 minutes or more, and then that's a round trip, 3-hour trip to see the family. So sacred duty, but we will never sacrifice quality for convenience. But if we can bundle them together through creative means, we would. One thought, Chris, for Dr. Nikhanj. Dr. Nikhanj, I should have prepared you for this, but when you think about your tele-ICU career, is there a story you could tell us, or a moment that was most satisfying to you as you've cared for patients and assisted teams? Does anything come to mind? And that may be unfair to ask you on the fly.
There are some stories that come to mind. I mean, just being a critical care physician, there, every day we're dealing with life or death matters. But I think there's one particular case that does stand out to me where this was at a smaller hospital as well, at a rural hospital, where there was a patient who needed to be put on a ventilator, so they needed to be intubated. So that's where we put a breathing tube into the airway, and so we can hook them up to the ventilator and support them. And that can be a very strenuous and dangerous situation, depending on what's going on. And this one particular patient was, they were bleeding in their airway. They had a lot of swelling in their airway. And the physician who was trying to put the breathing tube in was having a lot of technical difficulties, and the patient was essentially crashing. Given that this is an area of expertise of mine, I was able to walk the physician through getting that breathing tube in successfully, using some unique techniques that I learned through my training. And he was able to actually ultimately secure the airway and save the patient in that moment. And so things like that happen, in the critical care world on a daily basis. But the fact that we're able to lend our expertise remotely to the bedside providers to optimize care, that's just one example of how we do that.
Thank you. That's powerful.
That is, and I want to share your patient care philosophy that was sent to us, with your bio and a little bit about you and what you're doing. Everyone deserves access to high quality health care, regardless of who they are or where they live. And I think that's great, and that is an example. The story you shared is a perfect example of that. And in the beginning of the program, you mentioned, one of the things that you're very proud of, and that the Tele-ICU program accomplishes, is reaching the masses, reaching a lot of people or more people.
Yeah, no, absolutely. I mean, for one of the reasons I'm so proud of the work that we do is we're really able to do the maximum amount of good for the maximum number of people. This platform really affords us that opportunity, and it really is. It's an honor to be able to work for such an impactful program.
Just to, I know we're just down to a few minutes, but really grateful for Dr. Nikhanj and the pioneering effort of the Tele-ICU has led to some other advances within Banner. One of the first, in addition to the Tele-ICU, is telestroke. So with a stroke patient, every second matters as we try to intervene with medication and then other treatment. And so time is of the essence, but we need another Dr. Nikhanj-like expert, a subspecialist in neurology. So we use telestroke in our emergency department, where we can bring the patient to the doctor to the patient. We have our emergency medicine physician at the bedside and our ER nurses, and then we bring in a neurologist, which in a rural setting, not feasible across the country. There aren't enough neurologists. I would even say that through telestroke, we can bring a neurologist to the bedside possibly quicker than if he were across the hospital in a large hospital, if you know what I'm saying.
Oh, yeah,
And so that was another early area. Another early advance with tele that we have had great success with is telepsychiatry in emergency conditions, when a patient might be suicidal or may be a threat to themselves or others. We are able to bring a telepsychiatrist to the emergency room bedside very quickly to help guide how do we best protect this patient, and how do we get, what's the right course of treatment and care. Very complex in a different manner. And now we have telenephrology at the hospital, so any ER patients or inpatients staying overnight that we need a nephrology consult, including if Dr. Nikhanj feels a nephrology consult is needed, we have Southwest Kidney available to us 24/7. We're bringing our comprehensive sleep services. Dr. Nikhanj happens to be certified in sleep, but we're opening through Banner Sleep Services, and we'll have sleep specialists who will visit with the patient and interview prior to their sleep study and then after their sleep study. Very high quality care. So just an exciting thing that we're constantly looking to take Dr. Nikhanj's expertise of accessing patients through tele and bringing them elsewhere. One final thing, we're very excited that we were able to help fund $75,000 of tele support to the local Payson Christian clinic, which is served by volunteer physicians and providers. So this time, the tele expands the ability of volunteer physicians to be able to volunteer their time with less burden to them. And so Dr. Judith Hunt is the president of the Christian Clinic, and so Banner's very proud to have been able to help facilitate that advantage, working closely with Gila County and a grant that we were able to obtain.
A lot of great things happening in the telehealth field, and right here in Payson with Payson Medical Center. It is wonderful. Well, Dr. Nikhanj, thank you so much to you and your team for all of your devotion to the Tele-ICU program and your commitment. And I just want to thank you for that and your time, taking the time out this morning to talk with our listeners and the people of Payson.
Well, thank you very much for having me. I really appreciate it.
Oh, well, thank you. And yes, and thank you, Hoyt, for, again, setting this up and for everything that Banner Payson Medical Center is doing in the community.
Thank you, and thanks for allowing us to bring in Los Angeles this morning.
I know.
Thanks for appreciate this opportunity.
I know. It's wonderful. Well, thank you, and thank you to everyone who's listening, and again, thank you to Desert Financial Credit Union for sponsoring our Community Spotlight program. Time to get back to the music with some Aerosmith, U2, Bad Company, and more. But first, let's get an update from the National Weather Service.
For Payson and surrounding areas.
There we go.
Thanks,
Dr. Nikhanj. That was 25 minutes.
Good job.
That did go by fast.
It did. You did great. You did wonderful. Thank you. That was perfect.
Yeah, and in behalf of Dr. Edema, Dr. Rooney, Dr. Lee, etc., Dr. Booth, our Chief Medical Officer, Dr. Laura Ryden, our Chief Nursing Officer, and Brian Gandara, our med-surg